All right, so as promised, we said we're going to start the thorax series today. So let's start the thorax series already. So we're still going to be continuing on our upper limb question series. So we're going to do both thorax and upper limb simultaneously. So the first question here we have in our thorax series. I'm very much excited for this series actually. A 58-year-old man presents to the ER with crushing substernal chest pain radiating to the left arm. ECG shows ST segment elevation in leads 2, 3, and AVF. Coronary angiography reveals a 90% occlusion of a single vessel. Which of the following arteries is most likely occluded? Right. So looking at the question, they said there's elevation in leads 2, 3, and AVF, and it also says the 90% occlusion of a single vessel. So first of all, the option here says left anterior descending artery. The left anterior descending artery supplies your anterior parts, right, of the heart, or your ventricular septum, interventricular septum. And if there's going to be an occlusion of this artery, it's going to lead to elevation in leads V1 to V4, to leads V1 to V4, which is not part of the question. The left circumflex artery supplies the left part of the heart actually, and a occlusion to this artery is going to cause elevation in leads 1, V5 to V6, right? And the question C says right coronary artery. Now, the right coronary artery supplies the inferior part of the heart, and the inferior part of the heart, it now takes off a branch known as the posterior interventricular artery. And when there's an occlusion to this artery, the right coronary artery is going to lead to leads 2, 3, and AVF, which is the option here, which is in the question. So the answer is actually the right coronary artery, because an occlusion to this artery leads to elevation in leads 2, 3, and AVF. Now the question is, why is it not D? Since the right coronary artery gives off a branch called the posterior interventricular artery. And the thing is this, the question says 90% occlusion of a single vessel. Now, since it is a 90% occlusion, in clinical questions, when there is a 90% occlusion, it's most likely going to be the bigger vessel. So the bigger vessel in this case is your right coronary artery, which is the most correct answer for this case. The left marginal artery supplies the left part of the heart, is a branch of the left circumflex artery actually. So the answer here basically is your right coronary artery, because it's also supplies the inferior part of the heart, right near the diaphragm. Okay, so it's going to lead to your myocardial infarction, your posterior wall myocardial infarction. So the answer is your right coronary artery, and in around 70 to 80% of the population, it supplies the inferior part of the heart. So that's the correct answer.